on the internet, simply hcao.org, Healthcare for All Oregon. And we have a chance to treat our neighbors, to be groundbreakers in the treatment of our neighbors, to move ahead, hopefully ahead of the state of Vermont. Be hard to catch Colorado depending on how their vote goes this fall, but anybody who's, we sometimes have unfortunate experiences with our elderly relatives and a little glitch in Medicaid, but almost everybody knows that the inequitable way we have a single payer system for older Americans and not for younger Americans clearly illustrates that 9 times out of 10 people will agree younger Americans get an even worse runaround from an even worse private insurance system than anything that our parents or grandparents have to face. Because of the power of the insurance lobby, we need to engage. The way HCAO works is through neighborhood area regional coalitions as part of a statewide organization. And if you really want your children to have the best outcomes possible for healthcare, it's important that obviously the council pass this resolution to help move the state in the right direction, but that you engage on the local level, not just in quadrennial or biennial elections, but go to the website, hcao.org, and meet some good people and work on a very important issue. Thank you.
Thank you. Good morning. So I wanted to talk about expanding healthcare and being progressive and actually sending people that have drug problems out of the country to Mexico or Canada to go to Ibogaine clinics, which actually has been proven to cure addiction instead of prolong it with programs like methadone and other stuff. And the reason why Ibogaine isn't legal in America is because the pharmaceutical industry owns America. And I would like to see progressive health policies like Ibogaine clinics actually possibly coming to Portland. And we have an ayahuasca church here, which is legal under Oregon Constitution. And there's actually religions that are based on the iboga plant in Africa. So maybe with a little twerking of laws based on religious freedom, we could actually expand healthcare here in Oregon. And do any of you guys actually know about Ibogaine?
Heard about it. Appreciate you bringing it up.
Well, you should Google it. It's known all around the world, and it actually has an amazing rate of curing addiction, which would lower crime and all kinds of stuff. So that is something you can do to actually expand healthcare in Oregon and be progressive leaders and cure addiction, things like that.
Thanks very much. Thank you. Thank you all. Okay, next one.
Give Mr. Germain and Robert West for the last two signed up.
Come on up.
I'm going to pass my time on to Bob if you would like it.
Sure.
Good morning.
Good morning. My name is Robert West, and there's a few things I wanted to bring up. First, I'm all for the healthcare thing. The other thing that I wanted to bring up is that there got to be some kind of healthcare because, for instance, like last week when the fascist goons attacked peaceful protesters at City Hall, one guy got a broken arm out of it. I believe 3 or 4 people were sent to the hospital. And I think that something needs to come of that. They need some kind of medical care, some kind of where the city can pay for it or where the state can pay for it. One of the people that had a broken arm is actually stays at R2D2 and doesn't have money. And when he when he was at the hospital, he was met with a security force that stayed outside his door and dealt with doctors and stuff that had really bad bedside manner. And they heard that a 4-year-old girl was also transported to the hospital with pepper spray injuries. And I find it sort of ironic that the Portland police find it necessary to pepper spray a 4-year-old girl. To me, that's just beyond what I would consider even social, being social. There's no reason why the police should have forced elderly women, children, and adults and forced them to basically shove them outdoors, stomping and stumbling on other people. I understand an officer got injured in that, which I really don't care, because I was there, I was in the front part, and the police actually were the ones that initiated the actions. That's why I called them fascist goons, because they didn't care about public safety, they didn't care about anyone else's safety. They just wanted to force people out, and like I said, several people got injured, 4 went to the hospital, 20 had to lay in the street, and some of those that laid in the street were charged with disorderly conduct. And I haven't heard anything from City Hall or the police on any kind of apologies. The only thing that I've heard is that it's the protesters' fault for being in the hallway, and that people need, the people of this society of Portland need to decide: do they want mayors and commissioners that decide that they're going to allow police to assault peaceful people? And what's next? A Gestapo type police force? I heard you've talked about how you want to bring police officers in, and actions like that won't bring good police officers in. It'll bring in the racist cops. It'll bring in the cops that have vendettas against people. That's the kind of police force that you're trying to bring in, and we can use universal health care as a incentive, but the truth is that very few people like bullies, and I've seen a lot of bullies with badges, and the mayor and the commissioners really should be ashamed of themselves at the way the police reacted. They made sure that people that had tickets, I still got all 6 of my tickets, were not able to speak. Police weren't allowing certain people upstairs to speak. And I really think that the city commissioners and the mayor really needs to look at the situation. They definitely owe the public an apology. There's people out there, when the protesters got out and was on the sidewalk and the police came out and was pepper spraying people, you had bystanders looking around going, what's going on here? Why are they spraying people on the sidewalk and stuff? One lady was injured and couldn't move, and there was an officer standing over her, and she wound up being arrested too. 2 people were charged with coercion, which was ridiculous. The DA dropped those charges immediately. So that's what I wanted to bring up. I wanted to let you guys know that me and other people are getting really sick and tired of the brutality of the police force, and that I intend on doing everything I can to document and bring, also, if possible, bring civil and criminal charges against any officers or city workers that assist the police, condone the police, or anything like that, as far as assaulting, injuring, or anything like that to protesters or anyone else. Like I said, a little 4-year-old girl got pepper sprayed and wound up in the hospital, and the police said nothing about that.
Thank you very much. Thank you. Anyone else on this item?
That's on the Sunday.
Let's take a vote, please.
Novick?
Thank you so much to Senator Devereaux, Ben Garretts, and Nancy Sullivan for speaking today, and all the others who spoke. Especially I have to say Mary Lou Hendrick, and I still feel guilty about not supporting you, but that's Representative 2 years ago. And thanks to Lee Verser for his role on this issue. Without question, the Affordable Care Act has succeeded in improving health care for many people. Specifically, the Medicaid expansion has been a tremendous help in reducing the number of Oregonians and Portlanders who are uninsured. The expansion isn't perfect. Notably, it doesn't extend coverage to immigrants, leaving a large and unconscionable gap in the program. It's made a huge difference to many people, driving down the uninsurance rate in Oregon to just 5%. Recently, Marilyn Wheeler and I went to San Antonio to view a homeless services campus they have there, and they have a medical component of their services, and that costs them about $4 million a year. And I asked them how much of that would be covered if Texas had accepted the Medicaid expansion, which it rejected, and they said all of it would be covered. So I'm grateful that we did accept the Medicaid expansion in Oregon. But the Affordable Care Act has not made health care affordable for all, and it hasn't solved core issues related to affordability and the cost of health insurance benefits that are borne by employers and employees. It's important to note that health care is economic development. If we could drive down the cost of health insurance for employers, we'd go a long way toward improving their economic competitiveness. This resolution calls on the legislature to take the next step toward the goal of comprehensive, affordable health care for all. I'm pleased to support the efforts of Health Care for All Oregon, and pleased to vote on it.
Well, thank you, Commissioner Novick, for introducing this resolution. I was very proud to work with Mayor Adams and Commissioner Brandy Leonard in 2009 when we co-sponsored the resolution calling on the Congress to do this. Of course, they haven't yet, but at least we have President Obama having given us, as a country, a great step forward with the Affordable Care Act. I'm seeing Chris Lowe and Jim Robeson and Mark Strowitz and many people here who've been working on this for a very long time. You can tell by my accent, which by the way is more British because my family just came over for my son's wedding and we got stuck. So a couple of people said that healthcare is free in England or in Canada, and of course it is. It's costs quite a lot of money, and that's why Senator Deborah has a suggestion that we send it to the voters. The City of Portland has a great plan with wonderful benefits, and we haven't had a cost increase for several years in a row, I believe. So it is possible if you've got a well-managed system that focuses also on prevention and wellness, as well as getting people to see their primary care provider at the right time rather than waiting to go to the emergency room. We can do it. Please add my name as a retired registered nurse to the thousands of Oregon Nurses Association's members, of which I remain one, to support this. Thanks to Commissioner Novick and Laura Hansen on his staff who worked very hard on this resolution, as did Dan Salazar on my office. It's good, and we will be having a legislative agenda setting process in November. I encourage you all to be part of that, where we're going to not only see what other things do the citizens want to include on the city's agenda, but also have some training on how to advocate effectively at the legislature. So watch out for that date coming soon to a new near you. Thank you very much for all your work. Aye.
Well, thank you, Commissioner Novick, and all of you who are advocates for good public policy, because that's what this is. And this resolution is both timely and influential. Timely because, as Commissioner Fritz just mentioned, every legislative cycle we develop a package of issues that we care about, and we and our lobbyists go to the legislature in coalitions like this and try to make things happen. And it tends to actually work lately, thanks to an excellent legislature. So things like getting the ban on the preemption of inclusionary housing was accomplished last session in just such a coalition effort, where it was in our legislative agenda, developed with public advice, like Commissioner Fritz just said, and then carried down there. So this is timely and just in time for us to add that to our package, and I believe, obviously, that we should. Secondly, it's influential, and I want to reinforce your belief that in this kind of grassroots effort, because I see three areas where policymaking at the local level, and then sometimes rising to the state level, then starts to have a national or even a global impact. One is the environment. You know, I was a newly minted city commissioner, sitting where Steve sits, in 1993 when we passed the nation's first local climate action plan. Well, now there's cities all over the world with a climate action plan, and we're one of 80-some cities that are in the C40 group, and those cities turned out to be really influential in Paris when the latest climate change accords were adopted. Not to mention the fact that if we do what we've got in our plans, it'll have a huge impact on climate right there. So there's a case where grassroots action at the local level then has risen to the global level, and that's true now as we take up the question of fossil fuels in our city and how much, if any, expansion they should have here. Another area is human rights. That, you know, we passed a domestic partners ordinance when I was on the city council the first time around, and then we supported marriage equality, and other cities and states did likewise, and then it became the law of the land. And so on human rights issues, the same sort of bottom-up, grassroots-driven effort, yes, has changed the country for the good. And then the third is economic justice. That we've taken action here at this table on wages for our employees, on banning the box, and again, we're seeing that kind of upwelling from the community level to the state level to the national level. And I believe that's what's going to happen on this issue too. It's just the force of history. Maybe it's taken way too long for those of you who've been working on this for a long time. Thank you. But I do believe that more and more we're seeing that pattern where the people have their say at the local level, it turns into state policy, and it eventually turns into the law of the land, at least with a good Supreme Court. So we appreciate all of you very much. Steve, thank you for your leadership on this. Good work. All right. Thank you all very much. All right, let's move on to our next